Chapter 12, the respiratory system. I'm going to do my best to make this video less than 10 minutes. So let's jump into the respiratory system. The main function is to provide oxygen to the body, and it does that. Just not the respiratory system is involved in that. Remember, our cardiovascular system circulates that blood to get the oxygen where it needs to go. The respiratory system also eliminates carbon dioxide, which is just a normal byproduct of our body's metabolism. The gases can be carried to and from the cell and the blood. The respiratory system works close. Oh, I just said that with the cardiovascular system. Excellent. Okay, so external gas exchange between the outside atmosphere and the blood, and internal gas exchange between blood and tissues, cells, all the things. Next page, upper airway passageways. I am not going to read this to you. You guys can review this. The nose, the pharynx. Um, I will not, in this course, I'm not going to hold you to this anatomy, but maybe you should know that the naso-oro-laryngo-pharynx is located in the throat, in the head, right? Like it's a sinus passage, if you will. So if you, as long as you have that basic knowledge, and don't tell me that the on a test or an exam that the oropharynx is located in the foot, then we're good to go. So just have an overall knowledge. This describes the pharynx and all the pieces and parts and even what they do. I think I read, yes, here they're reconsidering tonsillectomies, which is very interesting. We've done them for years. But anyway, lower respiratory passageway and lungs, they have their own function with the vocal cords, the trachea. Here's the larynx, because the pharynx and the larynx are something different. That gives you great anatomical views there. The trachea inside the trachea and the different things, the epiglottis, the vocal cords. Dun, dun, dun. Bronchial system, this is when you're getting into the, well, I mean, it's all part of the oxygen exchange, but this is really where the microscopic type of gas exchanges occur, and the lungs. So you're heading down. We keep going down as we read this chapter. So the function of breathing is air being moved in the lungs. There are so many things that can prevent or hinder that pulmonary ventilation, but it is required for life. Your lungs must inflate and deflate. They must move. So, for example, like we can live without our spleen. We can live without an appendix. They can take our tonsils, our adenoids, female, male parts, but we cannot live without a beautiful, healthy set of lungs. Cannot live long, I should say that. So yeah, if you have something that hinders your lung ventilation or lung functioning, there's challenges there. All right, so breathing is discussed in chapter 12. You can read all about that. During inhalation, the diaphragm presses the abdominal organs downward and forward. Okay, yes, that's just, yes, I get that. I don't know why they're really talking about that, but that's cool. That is true. And during exhalation, the diaphragm rises. Inspiration, that's the beginning of the breathing cycle. When you inhale and then exhale is finishing a breathing cycle. We breathe about 16, 18, 20 times a minute, maybe for resting. Sometimes we can be as low as 14, and that's normal, as long as your oxygen saturation stays in the 90s. Gas transport. Oxygen is carried in the blood vessels bound to hemoglobin. You recognize that word. Terminology is listed here, key terms. Adenoids, alveoli, bronchial, bronchus, carbon dioxide, carbonic acid compliance. Diaphragm, epiglottis, you guys can read those and review the meaning of those words. Word parts, so suffixes, apnea, dyspnea. So, how do I say this? Dyspnea, penia. How about penia? Because apnea is the absence of breathing, dyspnea is shortness of breath or difficulty breathing. Oxia, so hypoxia is the low amount of oxygen. Hypocapnia. So capnia is a level of carbon dioxide. They measure this in the operating room. They want to make sure no one gets too low in carbon dioxide exchange when you're under anesthesia. Phonia is a voice, so aphonia is loss of voice. All right. Exercise 12:1. You can certainly do that. Here's more. These are root words for the respiratory system. Nase, naso, rhine, rhino, pharyngo, pharynx, larynx, laryngo, trache, tracheo, so on, bronchio, bronchi, bronchiole. Another exercise, 12:2, and then root words for lungs and breathing. Phren, phrenico, plur, pleuro, pulm, pulmo, pulmono, pneumo, pneumato, spiro. Da-da-da-da. A spirometer. So the word I wanted to see why that had spiro. That's is correct. Spirometer is a little device that you can blow in and blow out, and it helps breathing to increase your lung capacity. People who have surgeries do that type of thing. If you have asthma, they can measure your airflow exchange, and even if you're doing any kind of cardiac rehab, anything, we want to prevent blood clots in our lungs, and we want to have strong lungs. So that little piece of equipment can help you exercise your lungs, basically. Okay, clinical aspects of respiratory system. Infections can really impede the ability to breathe. Even a simple common cold, a coronavirus, can really impact our ability to breathe. And in 2025, I promise you, as far as technology and modern medicine has come, something like pneumonia, secondary to a severe cold or even the flu, it can and will still kill you in modern medicine and will continue, excuse me, because the lungs are so vital. If that cold and flu stay up in your sinuses, you can manage that as best you can. But the minute that the viruses or the virility of that cold or flu travel into the respiratory system, there is a battle ahead. So infections is a big deal. Of course, we have treatments. Pneumonia is talked about there, but not all the treatments work. Tuberculosis, this is not something we're going to see. I don't think we're going to see it in healthcare moving forward. However, um, with immigration and with international travel, it's still good to know about tuberculosis. It wasn't too long ago. So, for example, my great grandfather died in Raleigh, North Carolina, in a TB asylum. They put these people who tested positive for tuberculosis in these not mental, I almost said mental, in these hospital asylum style facilities, and that's where they received treatment. And he actually died in that. So not too far, and not too long ago. I'm not that old, and it's just wild. And now we have a vaccine. Um, I'm sorry, we do not have a tuberculosis vaccine. We have testing. Um, but anyway, I am trying not to talk too much. Then I find something I'm interested in and I say it. Okay, so TB skin test. This is something that we do as healthcare employees once or twice a year. There is treatment for tuberculosis, by the way, but the drugs, like one of them is rifampin, it is not kind to our body. So we do not want to get TB. We want to do our best to avoid that. Here's our influenza section talking about the flu. There's different strains of the flu. There is a vaccine for that. However, you could get vaccinated for strain A and then end up being exposed to strain B, and it doesn't really help much. It helps a little, but not much. So anyway, great hand washing, wearing masks if you choose, staying home when you don't feel well to prevent the spread. I think post-pandemic, we all know how to prevent the spread of colds and flus and all sorts of viruses. Croup is usually younger children. It's kind of the same thing, but they can't help but cough in somebody's face, or they wipe their hand across their runny nose, or they, cough into their hand and then they touch something. They don't have the hand hygiene that us adults do. However, some adults need to work on their hand hygiene also. That's a whole nother video. A common cold causes acute rhinitis, and that's that snotty nose, that's the allergies, itchy eyes, it can be ear infections, all the things. Emphysema, this is more of a chronic thing. This is either from exposures to chemicals for many, many years, or smoking cigarettes, vaping. Oh, I could do a whole nother video on vaping. We don't even know the entire effects on vaping, but I can tell you right now that it's not good. It's there's some of the Scientists and researchers are predicting it's worse than smoking cigarettes. So anyway, don't vape until we know more about it. Asthma, this a lot of this is genetic. Sometimes it can be environmental depending on where you live, but there is a lot of difficulty breathing with asthma. You take an airway that is moving air and suddenly it starts to squeeze tight together because it's reacting to something, whether it's stress or a allergen or anyway, asthma's pretty tricky. I have no idea what this is. Pneumoconiosis. 27 years in healthcare. I don't know what this is. So this must mean this doesn't happen in my area in North Carolina a whole lot. Lung cancer is very prevalent. Ironically, in the past couple of years, we have found researchers have discovered that secondhand smoke is worse than actually smoking a cigarette. And you can get lung cancer without even being exposed to anything. It just sometimes it happens, the mutations at the cellular level, whether that person had exposure to chemicals that we don't know about, or I don't, so many things that I could try to guess. Respiratory distress syndrome. Cystic fibrosis is not very common, but it is something you may see, especially if you work in healthcare in the Chapel Hill area. That is where the actual cystic fibrosis doctors are in this area. Sudden infant death is extremely sad. So many things you can do to avoid that. However, the point of sudden infant death syndrome is that you could do everything perfectly right, and that small baby still just stops breathing. Like their brain doesn't signal for that lung to take a breath. It's not extremely common, but it does happen, and for no known reason except the brain just didn't signal. There weren't the yeah. Anyway, you can read more about that in different literatures, even Googling and finding articles. Pleural disorders, pleurisy hurts. Diagnosis. Oh, so many ways to diagnose it. Lung scans, X-rays, pulse ox, arterial blood gases, ABGs can tell you if somebody's struggling. Da, 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 da. And I've gone over my 10 minutes. Yeah, I'm sorry. Careers in respiratory therapy, absolutely. Our respiratory therapists do a fantastic job at ventilating our patients in healthcare settings if they need a little extra help. Here's a great diagram of a bronchoscope. Yes, you can put a patient to sleep and go perform a bronchoscope. Sometimes this occurs to get a small kernel of corn out of someone's airway, or a chicken bone, or if they have a tumor or something in there, you can go and take a biopsy using that bronchoscope that is performed with the person of sleep, of course. More terminology. I'm kind of skipping over that because I'm going to run out of time. Read that, review that. Anything I tell you to read or review on your own, please just ask me questions if you have any. This labeling, again, I'm not going to hold you to this, but just kind of be familiar with it at a high level overview. And then this is kind of like a worksheet. Okay, 13 minutes. How about that? Hope y'all have a good week.